ready to share treatment tips with those who care at the Caregiver Call Center.
Hey Greg, my daughter's taking EPIDIOLEX, and I'm curious about how to manage any possible side effects. I'm all ears.
It's really important to think about all side effects with any medication, and thankfully today my good friend Dr. Labiner is going to give some information to help us all. Hey. I'm so happy that you're visiting us today. So I just got a message from an amazing caregiver. Could you share some tips on how to help manage some of the common side effects someone taking EPIDIOLEX may experience?
So some of the most common ones are going to be increase in liver enzymes, sleepiness, decreased appetite, and diarrhea.
What would you say to somebody that's actually experiencing those side effects?
I would tell them that I've been able to help a lot of my families through the side effects. Some of my patients experience side effects early on in treatment, which then will generally resolve as early as 4 weeks with or without dosing adjustments. Oh. And that's what we saw in studies too.
I didn't know that. And is there anything caregivers can do to help manage their loved one's side effects?
In my experiences, some instances of diarrhea can be managed by taking EPIDIOLEX with meals. Your doctor may also manage with dose adjustments. It just depends on what side effects you're experiencing, and then also making sure that you let them know so that we can give you the best information.
That makes sense. And you say meals, so breakfast, lunch, or dinner?
Yes, one study showed that high-fat foods help people absorb EPIDIOLEX, but low-fat foods will help you absorb CBD better than if you take it with no food at all.
Really? That's interesting. But what if I'm on a specific diet?
Well, EPIDIOLEX works with all kinds of diets, including the ketogenic diet.
Well, that's good for my keto caregivers out there. What else should people know about EPIDIOLEX?
If your loved one does take their EPIDIOLEX with food or not, the most important thing is that you take it consistently. So whether you take it with food or without food, we're really aiming to have you take it the same time every day to help avoid any changes in exposure to the medicine. But ultimately, you want to talk with your provider about what works best for you and your loved one.
Now, you mentioned liver enzymes. As a caregiver, what should I be looking out for when it comes to that?
Great question. So we're going to monitor that before you ever even start, so we have a nice baseline level, and then throughout treatment in the first couple months, and then regularly the entire time you're on the medicines.
Okay. Is there anything else that a caregiver should know?
Make sure that you're really open and honest with your providers about anything that your loved one might be taking, because that can affect how the medicines work. So we want to know over-the-counters, vitamins, any other cannabis-based products you may be taking. Tell your doctor so that we can help.
That is very important, yes. And that is a good line of communication like you and I have. Thank you so much for taking the time, Dr. Labiner, and your advice is always so appreciated.
I'm happy to help. And trust me when I say your provider does want to help you manage your loved one's side effects as best as we can. We just need to know so that way we can help and be honest with what you're experiencing.
I can always count on you for good advice. And as always, thank you for watching. We hope this helps.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.